I always love when I get to be with Lupe Cruz from LDS Hospital. She's a certified nurse midwife, and we are talking about a subject that I actually have lots of questions on right now. We are talking about breastfeeding, and this is a big month for breastfeeding. Why is that?
It is. It's Breastfeeding Awareness Month. August is Breastfeeding Awareness Month.
And so I'm grateful that you're here to answer all of these questions. You have the 8 most common questions that you're hearing as a nurse midwife that you are hearing people asking. Are you hearing this once they've had the baby and are starting to breastfeed, or before concerns people have?
It's throughout. People get a little bit anxious before they have the baby, and then immediately after, once they get the hang of it, then they seem to be a little bit better.
I still do have some questions, though, and we'll get to those later in the segment. But I love the first one, and this is what I had before I had babies. Does breastfeeding hurt?
So it's silly to say that you're not going to feel some discomfort. Babies are breastfeeding to maintain life because they're hungry. So they're going to breastfeed aggressively. And it takes a little bit of time for your breasts and your nipples to become accustomed to that kind of breastfeeding. But once you become accustomed to that, you could pretty much sleep through it.
Yeah. Well, I think lots of new moms do when they're so tired in the middle of the night having that. How do you know if your baby's latched on correctly?
So you want to... one of the things you want to do is you don't want to have your baby turning their head towards you. You want to have your baby, we say, to have the baby belly to belly on you. The nose and the chin kind of touching.
Okay.
And your baby, you want to make sure your baby opens their mouth sort of like a bird. If you get them on and it seems like they're not latched on, it's painful, they're fussy, or they're trying really hard, then you want to just take them off and do it again. You don't want to just say, oh, they're there, let's just keep going. Especially if you hear like a clicking noise. If you hear any kind of clicking in there, that means their tongue is not in the right place, and it's going to cause you damage to your nipples. Could be cracking, bleeding, a lot of pain.
Well, and I imagine they can't be getting the right amount of milk that they should be getting if that's happening. I never knew that. I never knew the belly to belly and all of that, so that's a good tip to know. Okay, this is a concern that I have right now. I was so nervous with my first that I would only pump so I could see exactly how much milk they're getting. How do you know if they're getting enough milk?
You want to look for cues. You want to trust your body. However, with that being said, some people won't produce enough and they may have to supplement. So that's one thing that you don't want to make moms, especially new moms, feel guilty for that. Sometimes that happens. But you want to look for the cues, hunger cues in baby. You want to look for about 6 to 8 wet diapers and about 3 to 4 stools after the first about 4 to 6 weeks. It takes a little bit of time to build up there.
Okay, and then that's how you can kind of know, because that's the thing. And the other important thing to know is when they first come, they don't need a ton of milk. You're nervous they aren't getting it, but they don't need a ton. Right.
The first couple days, their stomachs are little, like the size of a shooter marble.
Oh my gosh.
Yeah, they're really little, and it takes, you know, several days before they get even just a little bit bigger. So you have to think of the size. The colostrum, it comes out in drops. The colostrum is the thick milk that comes the first few days. They just get drops of that, and it's just high in fat, higher in calories, and that's what they need.
What do you say to people when they come and say they're worried if their breast size is an issue, whether it's not big enough or they are too big? Is it going to affect their breastfeeding?
It should not. No, the size should not matter. Your body's still going to produce breast milk.
Okay, well, what if you don't have any milk after your baby's born? Is that a big concern that people are having?
Yes, they do. They're really concerned about that because they don't see it coming out. And really, that colostrum is being produced months before you even deliver.
Really?
So it's there. And if after you have the baby, if you were to kind of milk some out with your fingers, you would see the little droplets of it. But, you know, it's thicker. It needs to come out with baby nursing. And like I said, it's just drops, really small amounts that are good for the baby to have, and they sustain your baby. So
well, and that's what they really need to have.
They need. We call that liquid gold.
I call that liquid gold too. I was going to say that. That's so funny.
It's really great. It coats the inside of the stomach. It helps, you know, build up. You know, when your stomach is really sensitive, you know, that kind of thing. It helps prevent those kinds of things, allergies, things like that. So we want them to have at least those first few days of that liquid gold.
Well, you seriously do want to have that. Thank you so much, Lupe, for being here. The rest of the questions that you're always asked are going to be up on our website, so go to that at goodforutah.com/GTU. Also, we're going to have a link to LDS Hospital for more information. Thank you so much for being here, Lupe. Hey, Brian, what's coming up next?